My name is Dr. Treasury and I will be carrying out your ASMR Cranial Nerve Examination today. Are you ready to get started? Good. It's a routine examination, very straightforward and nothing to worry about. I'll just need you to follow a few of my instructions here and there, but I'll let you know what's happening as we go along. So if you could please begin by sitting up nice and tall for me. That's it. Take a deep breath in and release and relax. That's it. Very good. I'm going to start by taking a look at your eyes, okay? So I have a little pen light here. It's a little bit bright, so you might want to begin just by looking at me. Whilst you're looking at me, I'm just going to have a look in your eyes there. You might see that pen light bouncing in and out of your vision, but try to keep that focus on me. Good. Your eyes are looking lovely and healthy. That's it. Okay, I'm going to move around a little bit, so if you could focus on a point behind me on the wall, just keep looking at that point. That's it, there we go, okay. Just need to come under here. The whites are just the right colour. No signs of any yellowing. Or any redness, so that's very good. Pupils appear to be responding normally to the light. Very good, okay. So what I would like you to do now, just for a moment, is to focus on the light itself here. That's it. Try to keep your focus right there. And just follow that light with your eyes, keeping your head nice and still as that light moves around. That's very, very good. Excellent work, keep it going. I'm just going to move in a little closer so I can look at each eye, so just keep your focus on that light there. Just watching what those eyes are doing. And I'll move across to this side as well. Very good. Okay. I'd like you to tell me now when the light disappears from your field of vision and when it reappears. So keep looking directly in front of you now. Focus on me or on my nose. And when the light disappears, just let me know. Keep focusing here. Very good. And when it reappears, let me know. same again. And when it reappears, very good. And I'm going to go up and down now, same thing again. Good. Very good. Excellent. Okay. Wonderful. Doing great, keep going. That's really, really good. Well done. Just checking for any blind spots there in your peripherals. I'm going to cover your right eye now. So just concentrate on the light for me with your left eye. That's it. Just follow it if you can. Good. Okay, that's very good. Let's swap for a moment to the other side. I'm just going to cover there like that. And that's it. Doing wonderfully. Well done. And look directly in front of you. Try not to look at the light this time. That's it. Focus on my fingers. Very, very good. Now I would like you to focus on my nose. And when the light appears in your field of vision, I just want you to shift your focus to the light, okay? Look at the light. And back to my nose. Very good. Same thing again. And back to my nose. Very good. And again. Well done. One more time. Very, very good. That's great. Okay, we're going to move on then to a couple of focus tests. So I would like you to focus for a moment on my finger here. Okay? And my finger is going to move in towards your nose, and I would just like you to follow it as closely as you can for as long as you can. Okay, here we go. Keep focusing on that finger. Tell me when it's a bit blurry. Good. And now follow it as it moves back out again. Well done. I'm going to do the same on the other side. So focus on this finger. That's it. And it's just going to begin moving towards you. So keep your focus on that finger all the way up to your nose, as close as you can. Very, very good. And all the way back out again. Good. Okay. to this finger. Good. And back to my nose. And now to this finger. Very good. And back to here. Back to my nose. And here. Back to my nose. Focus back here for me where my finger's moving. Good. And this one. And back to my nose. And back here. And this one. And back to my nose. Very, very good. Okay. Looking directly in front of you again at me. I would just like you to tell me how many fingers I'm holding up. So for this, it's very important that you keep your focus on me and try not to look at my hands. I will see if your eyes move, so no cheating, okay? Alright, here we go. How many fingers am I holding up? Good. And how about now? Okay, and now? And now? Good, keep going. Good. 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 Very, very good. That's great, well done. Okay, you're going to follow my finger now. So it moves in front of you, just like that. Well done. And all the way back. And all the way in again. And I'm going to cover your right eye. And you are going to focus on my finger here. And all the way in. Very, very good. And all the way back. Great. Swap over to this side, so covering your left eye this time. And you are focusing on my finger here. That's it. And following it all the way in. And all the way back again. Beautiful. You've done a wonderful job there. Do you find that if you are reading a book or using your phone that you tend to get any eye strain or headaches? There's an ever so slight discrepancy in the speed with which your eyes focus between your left and your right, so that could be contributing slightly, but we can look into that a little further, okay? Good, alright. I'm going to move on then to a Snellen chart. It's this series of letters. Have you seen one of these before? You have? Okay, so you know probably what I'm going to ask you to do then. I'm just going to point out some letters and I would just like you to tell me if you can see them. So to start with, can you see this board nice and clearly? Can you make out any of the letters on the board? Good, okay, let's begin then. So first and most easily, what is this letter at the top? Very good, and are these both nice and clear as well? Okay, what about this letter here then? It is, and this one? The one next to it? This first one on the line below? Good, and the end one on the line below? Great, and what are the two letters in between? Very, very good. Now can you read this line for me from left to right? Great, well done. Let's move on then to the line below. These are a little bit more difficult. Okay, let's start with this first one here. Can you see that one at all? Good. And the one next to it. The one on the end. And the one next to it. Good effort, okay, and the one in the middle. Okay. And how about any of the row below? Okay. How about the one in the middle? Alright, and how about this one here? What about the end one? Okay, so I'm just going to move this chart in towards you, and I would just like you to tell me when those letters on that bottom row there become nice and clear. Okay, so here we go. Let me know when they are super clear and no longer blurry. About there? Yeah. So could you read this row for me now then? Starting with this one. And the one next to it. And the middle one. And the next one. And the one on the end. Very, very good. And whilst we're here, can you tell me what colour this one is? Good. And what colour this one is? That's great. Well done. On that note, we are going to check your colour recognition now. Are you aware of any colour blindness normally? Okay, so let's have a little look then. I have a book here, and on each of the pages there is a kind of colour chart with various little blobs on it, and on each of the pages there will be a number contained within those blobs. On some pages it will be very clear to you, and on others it might be a little more difficult, so we'll just have a go and see how you get on, okay? Alright, here we go. Let's start with the first page. So can you see the blobs in different colours? Good, okay. What number do you see? It is number 12, well done. Let's try another one. If you failed on that one, that would imply that you have red-green deficiencies. Let's have a look at this one here. Can you see a number anywhere? What number do you see? Is that a little bit more difficult than the number before? Okay. And how about on this page? Can you see a number here at all? Very good, okay. Let's try a couple more with you. Okay, this one here. Tell me what you can see. Okay, so on this one, if you have no issues with the colour recognition, then you will not be able to problems at all. For people who have some red-green deficiencies, you would be able to see the number 45, and if you are totally colourblind, you would not be able to see anything at all either. Okay, good. I just have a couple of tracing ones now. So I would like you to take a look at this image. Are you able to see a bluey green line within this image? Okay, so I'm going to use my pointer to follow that line, and if at any point it disappears, I would just like you to let me know. Okay. Alright, here we go. So we're going to start here. Just tell me if at any point you can't see the line anymore. Keep your head still, just follow with your eyes. Good. Great. Did you see the line all the way along? Very clearly from the other colours. Very, very good. Okay, one more of those. Okay, so this line has segments of different colours. So part of the line is a kind of pinky purpley colour, and then some of it is more of an orangey reddy colour. If you have no colour recognition issues, then you will be able to see the line all the way along. If you have some red-green deficiencies, then you will only be able to see parts of the line. And if you have total colour blindness, this may all look exactly the same to you, or you may not be able to identify a line in there at all. So again, I'm going to begin here and trace the line with my pointer, and I would just like you to tell me if at any point that line disappears, okay? Good. Here we go. Good so far. Well done. To the end there. Good, that's great. Very well done. That's wonderful. Right, so I'm going to take a closer look deep into your eye now. I'm going to use this little device here, an ophthalmoscope, and this light here is just going to shine right onto the back of your eye, and let me have a good look at what's going on back there. Okay. Alright, so I'm just going to begin by looking into your left eye here, all the way to the back, just to see what's going on. Wonderful. If you can, try to just look here at my finger, just for a moment or two. this side to this side. Okay, so pick a point behind me, perhaps the plant here and the chart on this side, and then when I say switch, just switch your focus. Okay, here we go. So switch, 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 and switch one more time. Very good, well done. Did a great job there. Okay, that's all for the vision portion of the test so far. I think we should book you in for an eye test just to follow up on those focus issues that you were having, see if perhaps some glasses or a prescription could help you. But otherwise everything is all healthy and it appears you have nothing to worry about. The eyes themselves look very healthy. Okay. Wonderful. Okay. We are going to move on to a hearing test now. I'm going to begin by having a quick look inside each of your ears. I can tell already that you have been following along with my instructions and you don't appear to be having any issues, so I don't anticipate any problems here, but it's always best to check. So I'm going to use my otoscope, and again you'll see there's a little light in the end of here. I'm going to pop this one into your left ear first and just have a good look and see what's going on in there. So, oh, that's great. It looks lovely and clean in here. You're obviously doing a very good job of keeping these ears nice and clean. That's what we like to see. No signs of redness or infection. Wonderful. Let's have a look then on this side into your right ear. Okay, that's wonderful. You're doing an excellent job this side as well. Ever so slightly more of a waxy build-up on this side, but that's perfectly normal, absolutely nothing to worry about. No redness, no areas that look like they would be causing you any issues at all. Just overall a lovely, healthy ear. Okay, good. That's wonderful to see. So what I'm going to do now is I'm just going to whisper into each of your ears, and I would just like you to repeat what you hear back to me, okay? Very good, okay. Let's begin then with your left ear. 724. 1998. 2025. That's very good. 2033. Very good. Otoscope. Very good. Chiropractor. Great, well done, that was really good. Okay, I'm going to pop some headphones on you now. These are nice and comfortable, but I will just adjust them to make sure they're sitting correctly. Okay, so here we go. might sound a little bit muffled because they are noise cancelling, but can you still hear me okay? In your left ear and in your right ear. Wonderful. Okay. What I'm going to do now is I'm just going to play a few beeps into each ear, and whenever you hear a little beep or a tone, I just want you to raise your hand for me, okay? Alright, lovely. Here we go then with the first one. Are you ready? Okay. Good. You can raise either hand, that's fine. Keep going. Very, very good. Well done. Okay. We're going to move on now to something I call competing phrases. So you are going to hear 2 words, one in each ear. I'm just going to ask you to tell me what you've heard in a particular ear, okay? The first couple will be nice and easy because I'm going to tell you which ear to focus on first, but the last few will be a little bit harder. Right. Okay, here we go then. So, please concentrate firstly on your left ear and tell me what word you hear in your left ear.
Paddington.
Good, well done. And now if you could focus on your right ear.
Extractive.
It was very, very good. Okay, I'm not going to tell you this time, so you will just try to have to focus on both. Are you ready? Okay.
Dedicate.
What did you hear in your left ear? Okay. And the next one.
Alphabet.
What did you hear in your right ear? Very good. And the next one?
Exploration.
What did you hear in your left ear? Very good. Okay, next one.
Indigo.
What did you hear in your right ear? It was. Great job. Well done. Okay, let's just remove those headphones now. And I'll put those to one side. Everything seems to be okay with your hearing. I take it you don't have any earache or any kind of muffled or ringing sound in your ears? No? No issues with your balance at all? Perfect, okay. I'm going to pop some gloves on now just for a few moments, just so I can have a feel around your face. We're going to move on to looking at the nerves in your face and in your skin, okay? Good. Okay. So I'm just going to have a feel around your face, your head and your neck. If at any point anything feels at all tender numb or you get a tingling sensation, I'd just like you to let me know. Okay. Good. Okay, so I'm going to begin on the left side of your face first. Down onto your neck. Just around your ear here. Going to feel your under your jawline. Just feeling for any swelling or anything like that. That all feels good. Across your forehead. Down onto the right side, your right temple. And your right cheek. Across your nose. Your jaw. Okay. Wonderful. That all feels perfectly normal to me. No tenderness anywhere. No strange sensations as I was touching your skin there. Numbness or tingling or anything. No. Very good. Okay. So I'm just going to ask you to do a couple of things for me now. Firstly, I would like you to just lean your face into my hand on this left side here. That's it. Just lean your cheek into my hand there. Good. And then just press your weight into my hand as I press against you. Just try to keep your head steady. That's it. Very good. The same on the other side. Lean your face into my hand. Good. Well done. And I'm going to hold my finger underneath your chin. And I would just like you to try to open your mouth as I try to hold your mouth closed, okay? Very good, that's great. And now lean your forehead into the palm of my hand and just press into the palm of my hand there as I resist. Very good. I'm going to place my hands on your shoulders and I would like you to try to lift them as I try to hold them down, okay? Just here, that's it, and lift. They feel about even, good. And now if you could take my 2 fingers in each of your hands, so right hand there, that's it, just wrap them around, hold on. Good, and then just squeeze. That's it, squeeze my fingers. Good, okay, that's about the same strength in each hand, so that's very good. That's it, you can let go now. Good, thank you. Alright, now I would like you to stick your tongue out for me as far as you can. Good, and say ah. Good, and now place your tongue up on the roof of your mouth. Wonderful job, and now do a big wide smile for me. That's it, and now relax everything down for a moment. Very good, and now scrunch your face up into a little ball as tight as you can, like that. Very, very good. And raise both of your eyebrows for me. And now when I say blink, if you could just blink for me. Blink. 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 Okay, I'm just very quickly going to test your blink reflex with this cotton pad, so just relax yourself, that's it. Okay. Good. Good, that's all working perfectly normally, so that's great. I'm going to take my gloves off just for a moment. Alright, do you have any issues swallowing at the moment, either drinking drinks or food when you're eating your food? Not that you've noticed? Okay, very, very good. I'm just going to ask you to swallow for me if you can whilst I hold the front of your throat here. So if you could just swallow. That's it, very good. All feels normal. Okay. I'm going to do what we call a soft or sharp test now. This is just testing the sensations in your skin. So I have two objects here. The first is just this little kind of chopstick. It's not too sharp on the end, don't worry, but it is a little bit sharper than this very, very soft, fluffy cotton swab. So what I'm going to be doing in a moment is just asking you to close your eyes for me, and I'm going to press various areas of your skin with one or the other of these objects. And I would just like to tell me whether the sensation you feel is soft or whether the sensation you feel is sharp. Obviously, I will also be testing to see if there are any areas where you feel no sensation at all. Okay? Are you ready? Good. Okay, if you could just now close your eyes for me then. That's it. Close your eyes. Close your eyes. Very good. Okay, here we go. Is this soft or sharp? Soft or sharp? Good, that's great. Soft or sharp? Soft or sharp? Soft or sharp? Well done. Soft or sharp? Good. Soft or sharp? Soft or sharp? Good, 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 good. Soft or sharp? Soft or sharp? And just a couple down onto your neck now. Soft or sharp? Soft or sharp? Well done. Soft or sharp? Soft or sharp? Soft or sharp? Soft or Very, very good. You got all of those exactly right. That's it. You can open your eyes again now if you'd like to do so. I'm just going to pop these down. We're going to move on now to checking your olfactory nerve, that is your sense of smell and your nose. So for this portion of the test, I would just like you to close your mouth. That's it, and take a big, deep, slow breath in through your nose for me. And keeping your mouth closed, to just exhale through your nose. Very good, that all sounds nice and clear. So same thing again, but this time you are just going to hold your left nostril closed and breathe in deeply through your right nostril. And exhale through your right nostril. And now swap sides. And inhale. Good, and exhale. Wonderful. I'm going to use my otoscope again to change the head. I'm just going to have a look inside your nose for a moment or two, okay? So firstly on this left side here, have a look. Wonderful, okay. And on the right side as well. See what's going on there. Okay. Beautiful. Lovely and clear. So that means we can go ahead then and check your sense of smell. Have you noticed any issues lately with your sense of smell? Or have you noticed that foods don't taste like they normally would at all? No? Good, okay, this should be a breeze for you then. So I have a few cotton buds and some different bottles with various scents in. I'm just going to dip the cotton bud into each of those bottles, and I'll just let you have a little smell and tell me if you can identify the scent, okay? Okay, here we go. So here's the first one. Dip this one in here. And I'm just going to hold that under your nose for a few moments. It's quite strong. There we go. Do you recognise that fragrance? It is mint. Well done. Okay. And another one. Same again. That is lemon. Well done. Very, very good. Okay, last one. Let's see. I'm going to choose this one, I think. Okay. This one is perhaps a little harder to identify, but it is quite a strong scent. So what I'm going to ask you to do is just left side, your left side. I'd like you to cover your right nostril. Just hold it closed for a moment. That's it. Okay, I'm going to draw this in towards the left side of your face, and as soon as you can smell it, I would just like you to let me know, okay? Here we go. Okay, you can smell that already. Good, very good. Okay, and what was that fragrance? It was. Well done, that's really good. Okay, I'm going to do the same from the other side, but I better choose a different scent. Let's choose this one. Okay, right. Here we go then, final time. So if you could just hold your left nostril closed this time. I'm going to move this one in from the right. Here we go, and just let me know when you can smell it, okay? There. Good, well done. Okay. Do you recognise this fragrance? It is lavender. Well done. Very, very good. So I would say no issues there with your sense of smell at all, which means we can move on to your sense of taste. Have you noticed any issues with your sense of taste at all lately? All good, you think? That's great to hear. Okay, I'm going to begin by examining inside your mouth. I'm going to have a good look at your tongue and your teeth and your mouth as well. So if we could begin, please, if you could open wide for me and stick your tongue out as far as you can. Good, I'm just going to have a quick look here. That's it. Very, very good. There we go. And if you could lift your tongue up to the roof of your mouth again. I know you did that for me earlier, but I just want to have a look underneath. That's it. Well done. Okay, that looks all good. Wonderful. And you can close your mouth for a second to rest it if you'd like. Good. Okay, and if you could open wide for me and bite together, but show me your teeth. That's it, and open wide again. And bite together again. And open wide again. Okay, very good. Just while you are opening wide, I'm going to have a look in here at your teeth. That's great, okay. Well done. You can close your mouth again now. Do you have any jaw ache at the moment? Any toothache, anything like that? No? That's great news, okay. It all looks perfectly healthy in there. Okay, so I'm going to do a taste test now. I have a liquid in a few different dropper bottles like this. They are not sweetened or anything like that. There's nothing in there that could cause an allergic reaction or anything. All I'm going to do is place a few drops onto your tongue, and then I'll just give you a few moments to see if you can identify what those flavours are. You might find it easy or you might find it quite difficult, but let's have a go, okay? You ready for the first one? Wonderful, here we go then. Here's the first one. So if you could just stick your tongue out for me. And that's it, just 1 or 2 drops there. 1, 2, 3. few moments there to have a think about what flavour that might be. It is strawberry. Very, very good. Okay. Right, here's the next one. Okay, if you could stick your tongue out for me again. That's it. Well done. Just have a few moments with those while I get the next one. It is everybody's favourite chocolate. Well done. Okay, last one of those then. This one here. Okay, here we go. Tongue out for me one last time. Perfect. Just hold that one in your mouth for a few moments and see if you can identify that taste for me, okay? Okay. Cinnamon, it is very, very good. Well done. Not everybody gets that one, so you've done a really good job there. Okay, how are you feeling? That's great. You've done so well today. Yeah, everything's gone brilliantly. So I think the only thing that we need to do as a follow-up is just get you booked in for an eye test, just to check the varying focus that you have there and see if a prescription might help. But otherwise that is all good. So if you'd like to head out to reception just down the corridor, then we will get you booked in for an eye test with one of our opticians or our ophthalmologists, okay? Lovely. Alright, it's been a pleasure to meet you today, and I will look forward to seeing you again very soon. Great.